The content of this podcast is for informational and entertainment purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your healthcare provider with any questions you may have regarding your mental or physical health. The views expressed are those of the host and guests and do not replace personalized care from a licensed professional.
Welcome to Mindful Moments with Pedro Morante, a space where a nurse practitioner and educator shares real talk on mental wellness, mindfulness, and navigating life in and out of healthcare. Let's take a moment to breathe, reflect, and grow together.
It's very important, guys, to start slow, go steady. No, it's not a fast race. We're all in this together.
There's a lot of anxiety, depression, and PTSD going on. So just need to make sure that our message as a provider is heard by our minority patients. Making sure that we are here for you.
Good day to each and everyone. My name is Dr. Pedro Morante. I'm a psychiatric mental health nurse practitioner board certified and also a family nurse practitioner board certified. And welcome to Mindful Moments with Pedro Morante. This is a podcast indicated for those who are nursing leaders who are talking about resilience and also mental health, and also serve as inspiration to each and everyone out there that are pursuing the nursing career. Nurturing Minds the Nurse Way. And I would like to welcome our faculty and guest speaker today, Dr. Tracy Lee Wilson. She is a health equity and disparity champion, patient advocate, medical affairs, and also clinician. And she helped organizations by catalyzing fairness and access into healthcare's DNA. I would like to welcome on this special episode, Beyond the Bedside, Redefining Nursing Through Advocacy and Innovation, Dr. Tracy Wilson. Welcome, Dr. Tracy Wilson.
Thank you, Dr. Morante. I appreciate the time and the effort around bringing voice to us that are not at the bedside, but definitely still making an impact on patient care.
Great, thank you so much. And my first question for you is that you have such a rich nursing background, from bedside care to your leadership. Walk us briefly through your healthcare journey, and can you share the turning point when you realized your path would lead beyond traditional clinical roles?
Absolutely. And again, thank you for the time today. I would say as far as my journey started a little over 23 years ago, in nursing school. And once I graduated, I wanted to go into the NICU. I remember introducing myself to my classmates with my maiden name of Tracy Lee, and I love babies. So I was very purpose driven. I knew always I wanted to work with children, especially the smallest of us, and provide care to them. And that's exactly what I did. So my first clinical practice was in a level 2 NICU in Louisville, Kentucky, which is where I was from. And I would say probably my first pivot in my career is while I was there. In the NICU, I wanted more leadership. I wanted to do more, but my unit didn't have that capabilities of us having charge nurses there. And so I remember just saying, well, maybe I'll go back to school. And so I decided to go ahead and pursue my master's in nursing education. And while I was pursuing that, an opportunity came up for a new faculty member at our community college. And so I remember being very hesitant and scared about applying for it, but someone told me once that you know more than they do when they're in school. And so that gave me the confidence to be like, well, maybe I do know just a little bit more. So applied, got the role, and that was when I first entered into academia. As an assistant professor there at the community college, and fell in love with teaching. fell in the, and I've always loved education, but just to do it and provide education to the next generation, that's definitely what I love. And so decided once I finished that master's that I would go on and pursue additional education. And so I enrolled into a PhD in a family nurse practitioner program. But during that time, I met my husband. And then we ended up moving. So I was able to finish a postmaster's family nurse practitioner certification and just delayed my pursuit of my doctorate at that time. And so went back into formal clinical practice once I got my certification and went back into pediatrics. So back to what I knew and loved, and worked at a private practice there. And so did that for a couple of years. And then my husband is the one who works in pharmaceuticals, actually mentioned to me that that there's nurse practitioners that actually work for pharmaceutical companies and provide education. And I was like, oh, okay, that sounds interesting. He was like, and you could make a little more money. I'm like, well, let's maybe talk about it a little bit further. So that was my first foray into the pharmaceutical industry, out of the recommendation from my husband. And again, fell in love with it because I was providing that education to healthcare providers and their staff on a particular product that I was going to be supporting. And so again, fed my heart of education. And we decided after that we were going to start a family. So I, retired my work for just a little bit to start a family. And then we ended up moving, and I went back into clinical practice and started working in urgent care. And then while I was in urgent care, decided to go ahead and pursue my doctorate. And while I did the application process for my doctorate, they asked me, would I be interested in returning back to education since they saw my background? And so while I was pursuing my doctorate, I also taught as faculty at the university as well too. And again, loved education, loved the undergraduate students and helping those light bulbs cut on for them. And then once I finished with my doctorate, again, my husband once more mentioned to me that, that you can now be a medical science liaison in the pharmaceutical industry now that you have your doctorate. And I said, okay, let's take a deeper dive into this. And once I started looking into those roles again, I ended up getting one, and then I left academia and went back into pharmaceuticals, and that was in 2016. And I've been in pharmaceuticals ever since.
Oh my God, that's very inspiring. And I would like to really connect with you too because I also have like a preterm babies. And when you were telling me about NICU, it kind of like light a light bulb on me. And they were confined also for 7 weeks. So I really have a big heart for the NICU nurses out there. And also your journey from being a nurse to a medical science liaison is very um, inspiring. Like a lot of nurses out there will not think about your journey, but I think behind every woman is a man also, and your husband is also your cheerleader, which makes it appropriate also that behind every successful woman is a man, and the
There you
same thing behind every successful man is a woman. And I
go.
see it's a reciprocity in how you guys function as a partner, and I'm just really really inspired by what I'm hearing from you.
Yes, absolutely. It's been quite a journey, but I've loved every single moment of it, and it all makes sense in the end. Maybe in the middle of it, you're just like, why did I do this? But in the end, and being on this side of it, every single step made sense into the journey and where I am today.
That's basically true, and your insights about how inspiring your career pathway is really inspirational to each one of us.
Yeah.
My second question for you is that many nurses feel that they have to stay in their lane. What gave you the courage and clarity to explore non-traditional avenues in the healthcare system?
Yeah, and you know what? And that's a really good question. And I've explained this to people, many times before. It depends on your institution. It depends on who grew you as a nurse. And I am a graduate of the University of Louisville, Go Cards, School of Nursing. And my first semester in nursing school, they actually had us to tour and look at jobs that were outside of the bedside. And I got a chance to go and sit with a pre certification nurse who worked for one of the large insurance carriers where I'm from. And I remember being in there thinking, like, okay, so there's more than the bedside. There's more than just, than taking care of patients. And believe me, we all love doing that. But to know that there was a place that you could go after you made the decision that I want something more or I want to do something different, that showed me by having that experience that there are other things out there besides, again, being at the bedside and you still want to contribute to patient care in some capacity. And so once I had that experience, I think I never forgot it and just knew that there was always going to be another opportunity for me to do and make an impact on patient lives, patient care, so that outcomes are improved in the end.
I really, really feel your passion about being a nurse educator and also your non-clinical role. And it's very inspiring how we can improve our patient healthcare outcomes. And as they said, as nurses, we can work at every field that we want to as long as it's our passion. And we feel like it's not a job, but it's actually what we love to do. Right.
You got it. It's
Yeah.
it, it it's inspiring. I mean, and again, to have these conversations with people to let them know that, listen, nursing never leaves you. The mindset never leaves you. I mean, all of the brutal education that we went through to finish and get ready to take the NCLEX, each one of those steps prepares us to be an asset at any table that we're put in front of.
I love that one. That as nurses, we have so much things to offer. Our attitude, skills, and knowledge are embedded there, and it's up to us to unlock our full potential.
Absolutely.
Thank you so much. My follow up question is advocacy is clearly at the heart of your mission. How do you translate that passion into your work outside the clinical setting?
I think for me, because again, as I stated, that patient care is at the heart of everything that I have done. How can I improve the patient lives and outcomes? So whether I'm working one on one with the patient, or I'm at a more of a macro level and looking at population health and downstream to the patient, and how can we improve that? One of the things that was kind of eye-opening for me was after being in my role as an MSL for a while, I really started to kind of hone in on the concept of, I have these amazing breakthroughs. I have these amazing drugs that I get to talk to healthcare providers about. But if the patients can't get access to these breakthrough, life saving treatments and options, then what am I really doing?
Hmm.
And so that really fit into, I've always been an advocate. I've always, spoke up when there was something wrong, but to now take my voice at this kind of higher level and be able to ensure that the products and the options that I am working on, that any and everyone can get access to it. That just invigorated me even further and made me want to look at what are the various ways that I can ensure everyone, gets equal treatment.
Great. And as a patient advocate, I just love what you say that we could do so much for our patient and be the voice when they're not able to speak up, right? And we can amplify that voice as doing what you're doing right now as a medical science liaison. And you've spoken at conferences and developed educational tools. What message do you always make sure to leave with your audiences?
That's so important, and I think it varies from conversation to conversation. But I think what my passion area and what I have been leaving people with is around the art of active listening. I think us as nurses, we're really good at
Mhm.
making sure that our patients feel valued, heard, and seen. And again, doing that with that active listening, pausing, letting the silence speak for itself, holding a hand, asking, more follow-up questions, not just taking stuff at the face value, actually asking about, where do they live? Where do they work? Do they have access to healthy foods? So again, all of those social determinants of health, but also making sure, again, that, you're looking at those political determinants as well too. So, are the, voting, making sure they have access. If they don't, registering again, because my passion area is in those particular spaces. That's conversations that I like to have with people, is that I want to make sure that everyone leaves me feeling valued, heard, and seen. So I would say that's probably one of my key messages that I leave with any talk that I do.
Thank you. And I think that is a very important skills that we always need to emphasize for our next generation of nurses. That if patients are seen, validated, and heard, our treatment plan will be so much easier for them. And if we incorporate them, not just you're working for the patient, but I think we should work alongside with the patient, not for them, but with them. And then when we do that, everything falls into place.
You got it. You got it. It's a partnership. It's a team effort. So, with the patient, with their family, the caregivers that they have, it is definitely a team effort.
Yes, I could not further agree. And you are very clear with your mission to bridge the communication gap between healthcare providers and patients, fostering environments of trust and empathy. Can you identify a project or initiative of yours that allowed you to carry out this mission?
I think, from work that I've done in the health equity space, again, ensuring that healthcare providers themselves know how to have these kind of conversations, to um, actually doing community work and having discussions around Black maternal health and ensuring that they know what to ask for, what to say when they go to their healthcare providers, again, to ensure that they leave those appointments feeling valued, heard, and seen by those providers. And then working with colleagues like myself, that, what is the next step? Where do I go? And helping to partner and mentor them into whatever that career aspiration is, so that they can continue to not only use that nursing credential that they have, but that education and knowledge that they possess too, to make an impact on patient care at a greater ability.
I love what you mentioned about impact. I think as a nurse and advanced nurse practitioner out there, it's not all about our credentials right now, but it's how we create results and impact to the nursing community and amplify our voice with our role. And that's very important message that I'm taking away from our conversation right now.
Absolutely.
And on a more personal note, Dr. Tracy, was there ever a time in your nursing career when you experienced burnout or emotional fatigue? And what helped you move through it with intention and clarity?
I would say probably there's been a couple times where I would say that what's next? What's more? When I was in clinical practice my last time, and I was in, the urgent care kind of space, and if any of us that's worked in emergency room, any of us that's worked in urgent care, that it's very, very, very fast paced. But
Mhm.
these are sometimes, and a lot of times, some of the sickest people as well too. And they probably won't stay with you and need follow up and education. So education is really key. And I got frustrated by the administrative side of
Mhm.
things. I am one that I want my patients to leave me feel again I'll say it again, value, heard, and seen. I want them to understand their treatment regimen. I want them to understand their medications if I'm prescribing those. I want to ensure that they have follow-up if follow-up is needed with, that's their primary care provider, or if it's a specialist that they need. I want to ensure that they understand that and that the continuity of care actually stays in place and it happens for the patient. Unfortunately, when you're required to see 5 to 6 patients in an hour, that becomes difficult.
Mm.
And when you are, graded, if you want to say, on that kind of a metric, that makes it difficult. And so you get tired of fighting the business of healthcare. And so that's where I decided that I think I had had enough with the business of healthcare, but I was going to make an impact in another way. And that's why pharmaceuticals was definitely a passion area and where I wanted to take my efforts in that arena. And I would say another time was even being in pharmaceuticals. And as I stated already earlier, when I was left with the thought of, do patients even get access to these things that we're talking about? And so I decided that I wanted to go back and get another degree because if I'm going to be talking, I want to feel like I'm talking as an expert.
Mm.
And having a clear understanding of what health policy is, where did it come from? How did we get here? Because we have to understand our past in order to change our future.
Mm.
And so I decided to go back and get a master's in bioethics and medical humanities so that I could get that understanding of where we've been, where are we now, and how can we change it for the future for our patients.
Wow, I'm so much impressed by what you're telling me. I could not further agree that the past, present, and future are all interrelated. And what you're looking into is like to better the system, to better the healthcare outcomes. And what I'm hearing from you is like you really need to dive deeper and understand the past so that you can connect the current situation and improve the future.
Absolutely. And that's just, again, I don't know if that's something, specific to me, but I know that before I want to talk on a topic or, an issue, I want to make sure I have a full understanding of it.
Yeah, and healthcare policy and lobbying for our profession as advanced practice nurse is also done at the ANP, which I think you are very active and lobbying for our profession. We would like to always thank you for that, for doing it.
Thank you.
And in your view, how can healthcare system better support the mental health of nurses and frontline providers beyond the surface level wellness programs that we had?
Those are really good, things for us to be looking at, especially, now that post-COVID, right? Post-pandemic. And it really shined a really laser focus on what caregivers actually go through, what nurses, what doctors, respiratory therapists, physical therapists, all of us that are in the trenches of patient care, what we all go through. And I think some of the ways to better support these various entities is one, I believe in work-life balance. So just as you're pouring out and you're giving to your patients, you need to make sure that you're returning that same grace and forgiveness and care to yourself. Because as you know, there's the old adage of you can't pour from an empty cup. So if you don't have the bandwidth within you, and you're not taking care of yourself, how can you be of service to others, whether that's the patient, whether that's family, whether that's friends? So I'm a real big proponent of self-care. And I think institutions can, ensure that they have good support in regards to self-care, PTO, that time off, vacation, all of that, and and not making people almost feel bad when they do it. I think that's how institutions can be of better support, is ensuring that individuals are taking care of themselves, so that they can provide the best care to the individuals that are under them.
I could not further agree with you that self-care needs to be emphasized to our frontliners, to even nurses, nurse practitioners, wherever you are. And our patients need us the most. And if we cannot take care of ourselves, how can we take care of others? And that's something that we are calling for actions for all those that are involved with the healthcare wellness programs. Hopefully, you guys are listening so that we can improve the better care for not only for our patients but also the ones that are giving care, and oftentimes underappreciated and oftentimes neglected too. So please pay attention to your mental health and also your self-care. It's important.
Absolutely.
Make it
Couldn't
a priority, right?
agree.
Dr. Tracy, with your amazing journey in healthcare as a guide for nurses in their early careers who feel a deeper calling beyond the bedside care, how can they start building a path that aligns with both their purpose and professional growth?
Um, I would say one of the first things, and and maybe it's just me, me and my mom, was, my guiding force in all of this was um ask questions, be curious. I've loved mentoring and telling people that networking, there's a statement that says your net worth
Mhm.
is your network. So a lot of times it's not what you know, it's who you know, and then who knows you for opportunities, new roles, being involved in organizations, all of that. So I would say be curious, go up and meet somebody if you've never met them before, actually get to know your leadership. That was one of the things that I was never afraid of. I think, again, my mom and my dad always stated that they put on their pants one leg at a time too. So whether you're talking to the CEO or you're talking to the janitor, having a conversation and being curious with those individuals can help to bring them into your camp and lead to a really great relationship that could benefit you maybe in the future. So I would say networking is probably one of the biggest things that I would tell a new grad or a new nurse or someone that is wanting to make that pivot. Be curious and start networking with those people that are on the trajectory that you're wanting to head towards.
That's very important. I think what you're emphasizing is your network is really important. And they said if you hang out with the champions, then you'll be a champion yourself. You hang out with the losers, you'll be a loser yourself. So I think our network plays a vital role in how our trajectory is going to happen. And sometimes stars will align, and who knows who and your career pathways could guide you into your next steps. And I really, really agree with you that being involved with organizations, there's different organizations that are we can be involved with as nurse, right? For APRNs, we have ANA, ANP, different sub chapters that we can be involved with. And I really, really admire how you emphasize that.
Yes, and again, as you just stated about our organizations, again, I am a person who is a part of almost every organization, but I'm involved from the local level to the national level because each entity or each organization is going to do something different, for your nursing career and where you're going to be trying to go. So I see, also getting involved, as we're stating, you have to get involved so that you can start to make those connections and learn about other opportunities. Again, I just happen to be married to someone in the pharmaceutical industry, so that's how I really learned about it. But from other people, it has literally been because of LinkedIn. I get people reaching out all the time, like, "How did you do that? How did you make this pivot?" And so helping them, so I didn't have anyone to kind of build the roadmap for me. I've had to drive and read the map along the way. And hopefully I've left a few breadcrumbs behind me so that someone can follow as well too.
Right. And stars of the line, and look where you're at right now, looking back to your nursing career. Very so much impressed with it. Dr. Tracy, what's one lesson you've learned outside the bedside that has completely reshaped how you see nursing today?
Ooh, now that's a really deep question. Um, I would say it probably is going to go back to what we just discussed. It's going to be about network. I think early on in my career, because I was, trying to figure out, maybe, what is it going to look like? Maybe even one-sided, stayed in this one particular box. But I think once I started to have conversations with people in leadership, people that were maybe two, three, four levels potentially above me, and learning about their journey and how they made the pivots and the decisions in their career, I think that probably is what really changed my viewpoint and how I approach life, approach careers, I approach, my volunteer activities, is by having conversations with people that I don't know, but something about them is intriguing, and I maybe want to pull something from them into my own, if you want to say, toolkit or tool belt. So I would say that. I would say, again, the networking and getting to know people and talking, and asking questions and being curious, are all, really good things to implement into your life.
Great. Thank you so much for sharing that. And a lot of our viewers and also followers um, of our podcast are really looking forward to be inspired by you. And if your entire journey as a nurse, educator, and advocate could be summarized into one message for those still searching for their path, what would you want them to remember about the power of their voice and their purpose?
I stole it from the TSA, so from, the Travel Security Administration. And, when you go travel, you go to the airport and you see on the sign, see something, say something. I believe that is a key message that we all should take heed to. Whether, again, you're talking about something personally in your own family, you see something going on with a patient, you see a dialogue between another healthcare provider and a patient, or a colleague talking to another colleague, it's that you don't sit by the wayside and you do nothing, and you let, potential harm or anything could take place. No, if you see something, if something's not agreeing with in your spirit and you see something, step up, say something, because you could be changing someone's life, and because of you just speaking up.
Thank you so much for emphasizing patient advocacy. I can really, really feel the passion and hope it will ignite the passion of our listeners also in terms of helping our patients that are vulnerable too. And Dr. Tracy, I know you're very pretty much involved with ANP, and congratulations for being a fellow this year. How is that feeling? And if you can share our audience that are also wanting to have an experience, how did the process go and the whole process of you being a fellow?
Oh, thank you so much. It's still kind of pinching myself that it's even occurred or even happened. I mean, again, I remember being in NP school and graduating, because I've been a part of AANP since I was in nurse practitioner school. And I can remember when I first heard of the fellows and just like, oh, I'm never going to get there. um, and to fast forward to, maybe about 3 years ago or so, um, I knew the impact of my work, and I knew how it wasn't just, local. It was nationally. I was making a difference in the lives of the healthcare providers I was, working with, from, the patients. And so I started talking to people that were already fellows. So that was probably the first thing that I did was actually start having conversations with them and looking at who could be my particular sponsor for when I got ready to apply. And so once I started having those conversations, people started to look over my CV
Mhm.
and started to let me know like me, this is good, you need to maybe consider doing this, or you maybe need to consider doing that. Getting that feedback that let me know trajectory wise, okay, I think I'm going to be ready. I have this kind of a timeline. I need to accomplish these particular things upon the recommendation of these leaders that I was being influenced by. And I would tell you, last year I was didn't think I was ready. Let me preface it like that. I didn't think I was ready.
Mhm.
It was my mentors that said, "No, you're ready now." And it was the force of their hand that made me actually go ahead and apply for it. And we see the end result. So sometimes it'll be people in your life that actually give you the swift kick in the tush. That is sometimes necessary for you to get out of your own way, because sometimes we can let the noise of our mind tell us maybe I'm not, maybe no, you're ready. And I was.
Yay! And that's very inspiring for those who are out there that are wanting to also accomplish what Dr. Tracy has done. Remember, sometimes we tend to self sabotage ourselves, but there will be people that will be cheering for us. It's the amount of like network and also the people that you hang out with is really, really important to inspire more.
So important. So important.
Dr. Tracy, let's talk about your mental health. How do you take care of your mental health? And for those that knows you, I know you're doing so many things and volunteering and stuff like that. Can you tell us how you take care of your mental health aside from you doing so many things?
That's such a good question, and I'm glad that we're touching upon it. Being not a, not only a caregiver, as far as profession, but I'm also a caregiver in my life. So my husband, who is in remission right now from multiple myeloma, and my mother, who is also 5 years remission. She just hit her anniversary from colon cancer. I've been the caregiver in my personal life. Um, and I would say that me doing the self care hasn't always been the easy thing. Again, I'm one of those. So when I'm preaching to you all and telling you that self care, I'm also continuously talking to myself about it, because it's very easy to get inundated with taking care of everyone else and putting yourself on the back burner. And it wasn't until back in 2018, in the midst of my husband's diagnosis, and my father becoming ill at the same time, that I found myself in the emergency room with chest pain, which then led to me having to get a cardiac cath. So I would say, after going through that, I learned very quickly again that you cannot pour from an empty cup. And if you don't have anything to give to yourself, you surely can't give anything to anyone else. And again, I travel a lot for work. And so being on the airplane and them telling us you put the mask on yourself first before you put it on the person next to you. So we're getting all of these little notes and explanations and teachings to tell us take care of you. So I would say the way that I ensure now that I take care of myself is when I believe in taking my vacations. I do that. I believe in going on trips. One of the things that me and my husband love to do is that we love to go on vacations. And so we've been to, I can't even tell you how many countries and cruises because we want to enjoy life as it presents itself to us. And then I'm also one that I like to watch, crazy stuff on TV that doesn't require thinking. Using my brain all day. At the end of the day, I just want to have the TV to just watch, wash over me, and not have to process any more hard data. So I would say that those are the things that I do to take care of myself.
Thank you, Dr. Tracy, for sharing a personal part of your life, and we really, really commend you for that. And we're really inspired and we're able to connect with you. I know sometimes we take care of others, right? And sometimes there's a switch between being a provider to being a patient, as per se. And I think that's one of the hardest situation that we can be, because anybody could get through it. And I love you mentioned about taking vacations. Sometimes that's really, really refreshing, and also being able to have a different perspectives.
Mhm.
And visiting different countries, knowing their culture is also a part of our self-care too, that we're able to assimilate what they had. And I think thinking outside the box, that our life could be very short also, right? That we have to balance it out. Because sometimes we tend to work, 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 work and accomplish everything, and not enjoying life after all, and taking a pause. And sometimes vacation teach us that yes, it's okay to not do anything at all. Just lay down and enjoy the moment.
You have to. I think that's, like you're saying, we miss out on that. Some of our parents and our grandparents, and people before us, they didn't take advantage of that, or they weren't taught to take advantage of that. They were taught that you work, 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 and then in retirement, then you do all of that. Well, the blessing and the curse in all this is that it's life, and you don't know the beginning because you're here, but you don't know your end. And so by pushing stuff out, and you never know if you're going to be able to get to that, I think is just such a disservice, to yourself and to the life that you're wanting to leave behind. So I almost, for myself, I want to, leave no stone unturned. When that day comes, I want to be able to say, I did good.
Yeah, I'm so proud of you and your growth too, and thank you for emphasizing what we can do as a provider and also as a nurse to really do a self-reflection and self-assessment of how we can improve things out for to better our mental health.
Absolutely.
And what will be your call to action for those who are listening right now, and for those who are afraid to get out there and do the things that you're doing right now?
I would say the call to action is do it. One foot in front of the other. I mean, as you can tell, I like analogies and little quotes and stuff. Another one we can add to it is that, how do you eat an elephant? One bite at a time. So you have to start somewhere, and live a life of no regrets, so that you can leave that legacy behind that you're proud of, and that that you haven't left anything on the table. So I would say get started
Great. And the time to start is right now. Am I
right
correct?
right now.
Great. And I'm also looking into your LinkedIn. Your philosophical pillars are patient-centered approach, patient access and education, and also speaking engagement and thought leadership. So those are things that I really, really commend you for doing it. And I'm inspired. And a lot of our viewers and our also listeners will for sure be messaging you, or where can they find you?
I'm on, again, LinkedIn. So my name as it's listed there. So Tracy Wilson. I'm also on social media, at Dr. Wilson, Dr. Wilson 2016. So you can also find me on social media as well too.
Right. 5 to 10 years from now, what are your projects?
I think growing the community of nurses, nurse practitioners that are looking for opportunities outside of the bedside, and bringing voice to that. Because again, there are individuals, that are looking. They want to continue patient care. They want to continue their credential. They want to continue to make impact on patients' lives, but they don't know how they can do it outside of being just at the bedside. So I hope that in the next 5, 10 years that I've grown that community, where then we can all be a part of the see one, do one, teach one concept. And so they're passing on the message to others that there are other opportunities outside of the bedside. So I would say that probably is my main thing. I also want to just continue to raise awareness and voice around the topic of medical gaslighting as well too, because again, patients are entering the healthcare system, but they're leaving not feeling valued, not feeling heard, not feeling seen, and we're having negative outcomes to be a part of it. And so, again, bringing voice and awareness to this concept that has been, in the news for at least the last 5 years. To bring more awareness to it so that we don't have to continue to see patients suffer.
Thank you so much for emphasizing that, Doctor. Here you go again, Dr. Tracy Wilson. Once again, you guys are more than welcome to contact with her or connect with her. If you're looking for somebody to, if you have any questions or insights about what she's doing, and she is so amazing. I'm so impressed and so inspired and fueled by her passion as a nurse educator and also a change maker or a catalyst in terms of healthcare policy. So there you go again. Thank you, Dr. Tracy Wilson. Any final message for those who are tuning in for today's podcast?
Just again, get active, get started. Got to start somewhere. Why not start today?
Yes, and do not be afraid. Here you go again. Let's give a warm of applause to Dr. Tracy Wilson. I'm so happy that you joined us for today, and hopefully we can do some more collaboration. I think an hour is not enough to do so much about what you're doing with a lot of things that you're doing right now.
Absolutely.
So, thankful and for your generosity of your time.
Thank you.
I'll see you soon, Dr. Tracy Wilson.
Bye.
Pleasure working with you today.
Pleasure.
Thanks for listening to Mindful Moments with Pedro Morante. Be sure to follow the podcast so you'll never miss an episode. If you find value in our time together, leave a quick review. It helps more people discover the space we're creating. For updates and more reflections, follow us on social media. Until next time, take care.